So hello everybody, this is going to be your example video of what a Therax treatment would look like. It'll be similar to what you would do in clinic, but more importantly it's going to be what I'm going to be looking for your assignment this week and for your practical. So first things first, you always need to go through introducing yourself and getting consent to treat and those things. So hello, my name is Brent. I'm a physical therapist assistant. I'm going to be working with you today. What's your name?
Karen.
Okay, nice to meet you, Karen. And can you tell me what day of the week it is?
It's Wednesday.
Good. And do you know what city you're in?
Farmington, New Mexico.
Good, thank you. So I'm going to be working with you today. I see that you're having some problems with your shoulder. Can you tell me what your pain level is in that shoulder?
It's about a 5.
It's about a 5 out of 10. So
Yeah.
on a scale of 0 to 10,
Yeah.
10 being the worst, it's about a 5.
Yeah.
Okay. So can you kind of show me exactly where it's hurting? So kind of right up here in the front.
Mm-hmm.
Okay. Okay. So does it hurt when I kind of press deep, or is it a little more surfaced?
It's pretty deep.
So when I press a little bit harder, that's when you feel it? Okay. Well, your eval says you have some biceps tendonitis, and so we're going to do some things to kind of get that under control. The main thing you need to know about that is it's usually just caused by overuse and not properly using it. So the main thing I need you to do is to rest it, okay, for the next couple of weeks, and then we're going to move you into some exercises and stretches to kind of loosen everything up, okay?
Okay.
Okay. And so, because she's in an acute phase, I would normally just go ahead and go into probably like some ultrasound, some non-thermal ultrasound on that biceps tendon, because I know from the eval and from my minor assessment here that she has biceps tendonitis. We're going to kind of fast track this though and pretend I've been working with her a while so that we can actually do more of the stuff that we need to do for our treatment. So to begin, you always want to do a quick assessment, right? And so I've already assessed her pain. So Karen, what I'm going to have you do is I'm going to just take your arm and move it for you through several different ranges of motion. And when I get to a point where you can't go anymore, I'll be able to tell probably, but you can also say that's enough, okay? So we're going to start with shoulder flexion. And that's about as far as you can go with that.
Yeah.
Okay, good. And now I'm going to bring your arm out this way. We're going to do abduction. And that's about as far as you can go with that. Good. And now I'm going to bring your arm in. No problems there. And I'm going to take your arm out. And about 45 degrees there. And I want you to also just, you can keep your elbow here and just try and extend your shoulder back as far as you can. Everything's good there. Okay, now what I want you to try and do is, can you try and do those things for me on your own? So you're not able to really lift your arm there. How about to the side? Not there either. Okay, can you go in towards you? Good. And can you go out? Like turn your shoulder out. Can you do that for me? Good, but just not past as far as you can, okay? And now can you bring your elbow back? Good. And so what you're doing, a quick assess is just like mini MMTs and GONI, right? You're just seeing where the patient is at. I can tell already that she's basically 2 or below for shoulder flexion and abduction. So I know right away that those are the areas that I probably want to focus on. I also know through doing passive range of motion on her that she's only got about 110 degrees of shoulder flexion, somewhere around 125 degrees of abduction, and about 45 degrees of external rotation, and everything else is okay. So that's all a quick assessment is. I do want to show you if she was in a little bit better condition and was it like a 3, I would go ahead and have her just lift her arm and I would push down to resist. and see where she was at, right? If she was at a 3, she would drop down. She doesn't know that, right? But she would drop down right away, or if she was at a 4 or a 5, go ahead and resist me, just normal, right? So she's a 5 in shoulder flexion. And if they're above, 3, and you can do your MMT, you just do quick MMTs. You don't have to go through the whole rigmarole. Put it in flexion, put the arm in abduction, and then I want you to push in, have them do internal rotation. Now push out for me, external rotation. Push it, keep your elbow in and push out. There you go. Good. And then try and extend your arm back for me. Good. And so you don't have to go through the whole process. You're just checking to make sure they've got good strength there. We're not looking for an actual MMT grade. And you can do that with any group of muscles, just so you know. So if it was her elbow, I would go, okay, I'm going to try and pull down, stabilize here, flex, and try and prevent me from pulling down. Good. Good. And you can do the opposite, right? So I want you to try and push down. Good. For extension, you can do the same thing for wrist flexion, right? So I'm going to have you flex your wrist, and I'm going to try and pull it back out. Good. Now push out on my hand. So extend it. There you go. And now push. Good. And so you can run through any of those motions just quickly. That's what a quick assessment is, just so you know. Getting back to our treatment, Karen's shoulder flexion is the main issue here. So I'm going to work with her first on increasing shoulder flexion with a stretch. And so what I think I'm going to do here, if flexion is limited, extensors are tight, right? And so what I'm going to do here is I'm going to have her fire her extensors. I'm going to just do a hold relax. And then I'm going to stretch her. So what I'm going to do, Karen, is I'm going to bring you up into your range of motion as far as you can. I'm going to push a little. We're going to hold it for 30 seconds. So we're going to pretend that was 30 seconds. And now what I want you to do is I want you to push down into my hand. Push as hard as you can. Push with your shoulder. Good. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. And now I'm going to push you further into a stretch. And we're going to hold that stretch for 30 to 60 seconds. So we're going to pretend that was 30 seconds. And now relax. And I want you to do the same thing again. Push down into my hand. Push, 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 push. Relax. And I'm going to stretch her further into that. I would do 3 sets of that for 30 to 60 seconds. Okay? So for her strengthening, since I know she's not able to lift her arm on her own, I know that I need to put her in gravity eliminated for her strengthening. So what I want you to do is I want you to lay on your left side for me, facing out. And I want you to try and scoot right to the edge if you can. Good. Okay. And go ahead and extend your legs. Okay, so now that I've got Karen into gravity eliminated position, I'm going to do some strengthening with her. Because I know from the eval that she's a 2, I'm going to still go ahead and check it. So Karen, what I want you to do is just now try and flex your arm as far as you can up. Okay. I've made a homemade Southern Ingenuity powder board here in the clinic. You would obviously have something better. So what I want you to do is just bring your arm up as far as you can. Okay, can you do that for me? Okay, about here. Mm-hmm. Okay. And so then I would check and make sure that the problem is just the, not weakness, but that she has tightness, right? And since I know she already has tightness because I already checked that, I know she's basically a 2. She can move her full available range of motion in gravity eliminated. So I know she's a 2. So that means that I need to figure out a way to strengthen her strengthen her in gravity eliminated, but I want to do something in clinic that's going to be a little more hands-on. So what I'm going to do with her are what are called multi-angle isometrics. So Karen, what I want you to do is I'm going to put my hand right here, and I just want you to push into my hand. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. I want you to relax now, and we're going to move you up a little bit more, and I want you to do it again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. And I'm going to move you as far as I can. Okay. And I'm going to do it one more time. Ready? Go ahead and push. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So notice that I'm putting my hand flat, as close to the joint as I can, and I am resisting for about 10 seconds for an isometric hold, and I'm resisting in the direction that she needs strengthening, okay? It's opposite of what we're necessarily going to do with a hold, relax, contraction, right? Because I'm trying to strengthen those flexors instead of tiring out the extensors. So I would do that 3 sets of 10 for each angle. So I would go again, push, 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 relax, and then move it. And the point of doing this is that now I'm strengthening this muscle, but almost in the same way as if I was getting full range of motion with her. So she's getting resistance and strengthening in all the different fibers, almost like she was doing resistance without it. If this was too much for some reason, like if I got her down here and she was like, that's starting to hurt or that's too much, then I could adjust it. I could just have her do active range of motion, or I could just have her do isometrics. So one of the things that you'll get asked on your practicals is, how would you adjust that if it wasn't working well for the patient? Just back it off one, right? And so if she can't handle maybe multi-angle, maybe I could just do one isometric contraction at the beginning of her range of motion for her, or I could just have her do active range of motion on her own in gravity eliminated. Once she's strong enough, right? So she's at a 2. If I get her to a 2+, I can add resistance in that full range of motion. So I'm going to add a TheraBand to this exercise. I'm going to tie a knot here, okay? And I'm going to place it in her hands. So just squeeze that. Make sure the knot's on the top side and make sure their thumb's pointed up, because we don't want to cause impingement there in the shoulder, right? So thumb pointed up. So Karen, what I want you to do now is just go ahead and slide your arm through that whole range of motion as far as you can, 10 times for me. Good. Ooh. This happens sometimes. This is an old TheraBand. We'll try it again. Okay, so now that I've fixed our band, hopefully, go ahead and try that again for me, Karen. Good. Good. And so just watch their form, make sure they're not compensating or substituting in any ways, and that they're going through as full a range of motion as possible. Right? So, good. Try and bring it down all the way if you can. Good. Right? And so just watch them and correct them. Okay? Good job. I would have her do 10 sets, and this would be a progression from those alternating isometrics if she was at like a 2+. So always be thinking about not only how to treat them where they're at, but how would if they were having a bad day or if they weren't as good as the eval said, what could I do with that patient to regress that exercise, and what could I do to increase that exercise, right? And so anyways, that would be her shoulder flexion in clinic exercise. I've already done her stretch, so now I'm going to educate her on her HEP. Okay, Karen, so now your home exercise stretch that I want you to do, and I'm going to send you home with pictures of this and instructions on it, is just what's called a flexion stretch, okay? So what I want you to do is just start out with your hands here. I want your thumbs up, okay? And I'm gonna have you like sitting in a chair, and I'm gonna have you trade places with me in a second. You can just watch here. So thumbs up, and then you're just gonna kind of push your arms out and bring your body down, and then go as far as you can, and then lean into it a little bit. Right? You should feel a little bit of stretch. Right?
Okay.
Okay. You'll feel it in the back of your arms here and kind of down your side. Okay. So start here, push out, lean into it, get to that point, and then I want you to try and hold it for 30 to 60 seconds. Make sure you're breathing, right? And just count out loud. So 1, 2, 3, 4, 5, and we're just going to skip to 30 now. 28, 29, 30, and then you can come back up slowly, relax, give yourself a minute or two, and then do it again. I want you to do that. We'll also do that twice a day, but 3 sets of 30 to 60 seconds. Does that make sense?
Yes.
Okay, so I want to see you do that if you want. I'll move it a little closer since I'm just a little bit taller than you. Good. Try and keep your back straight if you can. Good. And then hold it for 30 to 60 seconds, and then now you can relax and bring it back. And then just do that again. Make sure to keep those thumbs up, and you're just leaning into it as far as you can, okay? Good. Good. Okay, you can come back up, and the goal is to get to where you can go all the way up with your head in between your arms, okay? Does that make sense?
Yeah.
Do you have any questions for me?
No.
Okay, so make sure that you do this first, and then I want you to do that strengthening exercise afterwards, okay? It's because we want to strengthen in that new range of motion that you've gained. Does that make sense?
Yes.
Okay. So, laying on our side with the pillows is our strengthening, and then this will be our stretch. And then I'll see you again in 3 or 4 days, okay? All right, if you have any problems or things get more painful, stop what you're doing and contact us, okay?
Okay.
All right, we'll see you later. Okay, so that's what you're looking to do. Just make sure you're doing a good quality exercise in clinic, a good quality stretch, a PNF stretch specifically in clinic, and that you're sending them home with an easy and doable stretch. If you notice, I did her a stretch that would allow her, even at a 2, to go ahead and fully extend her arms because she's in a more gravity eliminated type position. In fact, gravity is helping her because she's leaning into it. And make sure that you're just kind of considering all those different things. Also, be prepared to regress or progress that exercise as needed, okay? So think about those things as you're preparing your video for this week and as you get ready to prepare for the different scenarios that I'm going to give you for your midterm practical. If you have any questions, just like always, make sure you ask me. I'm happy to help.